Business. Now, of course, we are on a hamster wheel so far as this coronavirus is concerned. We're doing very well on vaccinations, better than anybody else in the whole world. But our death rate is the worst in the whole world. Go figure. Explain that. Well, if anyone can, it's the Moat's medic, Dr. Ranjeet Brar. And welcome back, Doctor, to the show. Let's deal with that paradox first. How can the same people have presided over the worst outcome in the world so far as death is concerned, but have the best record in the world of rolling out the vaccine?
Thanks, George. Good to be with you. Good question. It's not quite true. So the worst death rates in the world are seen in some really very small countries. Gibraltar, which I guess is part of England, has a death rate of 2,200 per million of the population, which is the worst. San Marino, again, is a tiny statelet of Italy. And then Belgium, which is more like the size of the city of London, has a high death rate of 1,800 per million. And then Slovenia, slightly higher than the UK, and then the UK. So we're like the fifth worst, but of the major countries, we are the worst. There are features of our population, as we've discussed, George, that make that the case. We have an elderly population with almost 4 million population over 80 and 13 million, more than 13 million over 70. So a large number of elderly population, and more than about half of our population over 40. That's similar situations found in other developed countries. We have an unhealthy population. We have world-beating rates, nothing to be proud of, I'm afraid, of obesity. And following on with obesity comes type 2 diabetes. We have more than 4 million diabetics in our country. And the obesity rates, I don't keep very close track of, but it was predicted by the end of this year that as much as 70% of women and 80% of men in our country would technically be obese. That's a huge figure. And we know that coronavirus hits an obese population. Cardiovascular disease is also high in our country. But there's more than that. It's the economic factors that go with our country. It's a laissez-faire, free market, fundamentalist economy. Since Thatcher, so over the last 40 years, we have glorified in the regulation of the market. But not only the Tory government, of course. Gordon Brown famously, when he came into government, said there's nothing more efficient than the free market, and used it increasingly to regulate our health sector. And that question of free market, of an internal market within the NHS, of buying and selling goods and services within the NHS, a bit like buying and selling goods and services within the family. Your children could sell you affection and you could sell them a roof over their heads. It doesn't make any it doesn't make any sense, and it certainly hasn't led to efficiency. 20% we know of the NHS budget is used on management, whereas before the introduction of this hallowed free market, internal market within the NHS, that was less than 3%. And the only real purpose of that massive increase in spending is to enable increasingly more and more goods and services to be contracted out from the NHS to the private sector, and that indeed is what we've seen. And that has been an extreme example of that within the pandemic, where we've seen 42 billion famously assigned to Operation Moonshot for testing, 6 billion on a track and trace system outside the NHS, not using the NHS's expertise, which was totally ineffectual, not a total waste of money, but totally ineffectual, and corrupt bidding of contracts on every level, PR contracts. Even the vaccine acquisition, which you say we've done well on, huge amounts of money was pumped into that, and who was overseeing that? Well, it was a Tory party grandee's wife, who is a finance capitalist who works for a venture capital firm. And yes, we have brought a lot of vaccine doses, but again, that is, if you like, something that our countries who have a lot of money can do well. They can't alleviate inequality.
Other countries with a lot of money haven't done. And we are 5 times better than Germany, or at least we were a few days ago, and 5 times better than France. They've got a lot of money also.
Yeah, that is true. So maybe you can say it simply, our government does contracts well. And we see like the spat, I think, very embarrassing, both to the EU and Britain, really almost a trade war developing. You can see the solidarity between European nations on full display when Ursula von der Leyen is essentially threatening to withhold exports of vaccine to Britain because a company operating out of Britain, obviously AstraZeneca, was unable to meet its targets, apparently, for exporting vaccine to the EU. So the EU has done worse than us. Vaccination, of course, was not the best way to deal with the problem. It's something that can be addressed within the framework of our system. But certainly as we go on from this point, vaccinations are going to become increasingly important. And what's very clear is that the vast majority of vaccines from the large multinational companies have been brought up by a few of the largest and most wealthy, powerful, really the NATO countries, George.
Now, the death rate, pardon me, finally is coming down. Hospitalization coming down, still very high. We would have been horrified at the numbers that we are happy about today because they're less than they were yesterday and the day before. About 1,100 people on average died last week in Britain, every single day. And back in March, we've talked about it before, they were desperate to keep the number under 1,000. It's been up about 1,800 on some days.
That's right, 1,800, 1,600, 1,500. I mean, I looked for the last week, it's 9,500 test-proven cases. People have died in our country. So that's in 1 week. So that is still the highest mortality out of any week we've had throughout the whole of the pandemic. So yes, case numbers are decreasing. And I think the case numbers I looked at were, I can't see them clearly written down here, but it was something like 250,000. So it's a big fall of about 200,000 over the last 2-3 weeks. So in that respect, the lockdown has achieved just that. It has slightly decreased the rate of transmission, so cases are going down. Hospital numbers, actual people in hospital beds, are relatively steady. About 35 to 40% of the hospital beds still occupied by patients with coronavirus, still meaning all kinds of elective procedures can't be performed, and really putting all other kinds of services on hold or under capacity, very inefficient system becoming ever more so. And I'm afraid during this period of time, we have seen steps towards the final culmination of the process of merging our clinical commissioning groups, or groups of GPs who are fund holding, moving towards their own method of developing and delivering healthcare, in which they will have very close partnership with large multinational health insurance firms, again, driving us further down the road, not protecting NHS, but far from it, really cementing the final steps to a full privatization and seeing us then embark on a system which will be very similar to America's, which is one of the few countries that has probably done worse than us in the COVID pandemic, George.
Yeah. Now, yesterday was, I think, a record number of people vaccinated. Who's doing this vaccination, Doctor?
So the vaccination is being rolled out via the NHS. It's being rolled out initially because of the storage problems. It was principally being rolled out from hospitals, town halls, large centres close to hospitals where the vaccine could be distributed. It is NHS staff overwhelmingly who are performing that, and increasingly GPs and GP surgeries, particularly with the AstraZeneca vaccine, which obviously doesn't have this minus 70 degrees storage problem, who are able to perform those rolls out. So I've got friends who are GPs who have been really addressing themselves and their practice, doing very long days, long shifts, in order to really run a very extensive program of vaccination. So it does seem that the vaccination itself is actually being administered via the NHS and NHS staff, George.
They're doing a great job. They are, in England, a fantastic job. Wales and Northern Ireland, a pretty good job. Scotland, a very poor job. And we've spoken about that earlier in the show, about the threat, I call it a threat, by the Scottish government to release to the EU the confidential details about British supply to them, aiding the EU in its war with AstraZeneca over having given Britain too much. Any comment on that?
So I haven't seen the ins and outs of it, but I mean, what I've been following of what's been happening with the S&P has been pretty disastrous over the last week for the S&P. They've really shown themselves to be not only persecuting their former leader, but persecuting people who are reporting on that in the form of Craig Murray. That's been very evident to me. But it's clear that in the S&P, certainly the last election and before that, had a game of splitting off from Britain. But then not becoming really independent, becoming a small statelet and an outpost of the EU. Clearly, it's very important for them to curry favour with the EU if they really think that they're going to be able to follow that plan through. I don't see it as being viable, George, for them to be such a small country, just as a tiny statelet of the European Union. But of course, there are other examples of that. But it would make sense, I guess, to them to try and show a sign of loyalty to the EU.
Yeah.
Really, their end goal and their strategy is always to seek independence, but it's not a look, George.
You'll like this one. On a lighter note, we have Harvinder Rishiraj on YouTube. He says, I took the vaccine last week. So disappointing. I didn't trigger a single 5G mast. And we're inundated by people saying that the clock that's behind you on your wall says it's 9:45, which means I'm actually conducting this interview with you in the future, and that therefore we're lying. We're not live. So I just want to make it clear that you need to adjust your clock. Dr. Ranjeet, thank you very much indeed for joining us
on
the mother of all talk shows. That is so funny.